Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam, also DSSSB, ESIC, AIIMS NORCET exam, also DME exam, Insurance Medical Service Kerala PSC exam, also Jphn exam. Today we can discuss questions from pediatric nursing. And the first question we can see, birth weight of a newborn baby is 3 kg. Which is the expected weight of the baby at 1 year of age? Options, option A 6 kg, option B 9 kg, option C 12 kg, option D 15 kg. Here our question is, the birth weight of the baby is 3 kg and the expected weight of the baby at 1 year of age. So, the birth weight of the baby doubles at the age of 5 to 6 months and triples at the age of 1 year. Triples means 3 times. Okay. So, here newborn's birth weight is 3 kg. 3 into 3 triples means 9 kg. Okay. So, the answer is option B 9 kg. And the next question, at what age do first permanent teeth appears? Options, option A 4 years, option B 5 years, option C 6 years, option D 7 years. The first permanent teeth appears at the age of 6 years. Option C is the correct answer. Permanent teeth eruption we can see by 6 years, first molar teeth, and 7 to 8 years, central and lateral incisors, by 9 years, first premolar, by 10 to 11 years, second premolar, 11 to 12 years, canine teeth, 12 to 13 years, second molar teeth, and 17 to 22 years, third molars or wisdom teeth. And the next question, growth chart is also known as options, option A New Billard scale, option B Road to Health chart, option C Glasgow Coma scale, option D Apgar score. Growth chart is also known as Road to Health chart. Option B is the correct answer. First option, New Billard scale. It is used for the assessment of newborn gestational age. And the next question, which condition is also known as trisomy 18? Options, option A Edward syndrome, option B Patau syndrome, option C Turner syndrome, option D Down syndrome. Question, which condition is also known as trisomy 18? And the correct answer is option A Edward syndrome. There are 3 types of trisomy. Trisomy 13 is Patau syndrome, trisomy 18 is Edward syndrome, and trisomy 21 is Down syndrome. Here our question is trisomy 18. It is Edward syndrome. The next question, which cause Klinefelter syndrome? Options, option A XX, option B XXY, option C XO chromosome, option D XYY chromosome. Klinefelter syndrome means presence of an extra sex X chromosome in male. Extra X chromosome in male, that is known as Klinefelter syndrome. So, total number of chromosome is 47. XXY. Extra X chromosome in male is known as Klinefelter syndrome. And the next question, Wermer syndrome is considered as options, option A MEN first, option B MEN second, option C MEN third, option D MEN fourth. Multiple endocrine neoplasia type 1 is known as MEN, multiple endocrine neoplasia. It is a hereditary condition associated with tumors of endocrine gland. This MEN1 is known as Wermer syndrome. It is a hereditary condition associated with tumor of endocrine gland. This is known as Wermer syndrome. And the next question, one or more premature closure of the cranial suture is called option craniostenosis, option B macrocephaly, option C microcephaly, option D none of this. And the correct answer is option A craniostenosis is one or more premature closure of the cranial suture. And the next question, abnormally high accumulation of CSF in the intracranial space is called? Options: option A hydromnios, option B hydrocephalus, option C hydrocele, option D all of this. Accumulation of CSF in the intracranial space is called hydrocephalus. Option B is the correct answer. And the next question, crack port sound elicited while skull percussion indicative of increased intracranial tension is known as? Option A Hoffman sign, option B Romberg sign, option C McEwen sign, option D none of this. And the correct answer is option C McEwen sign. McEwen sign is one of the earliest sign of hydrocephalus. Here cracked port sound are elicited while skull percussion. It is one of the earliest sign of hydrocephalus. And the next question, increased knuckle translucency observed in 13th week of fetal ultrasound is the characteristics of? Options: option A Turner syndrome, option B Klinefelter syndrome, option C hydrocephalus, option D Down syndrome. And the correct answer is option D. It is Down syndrome. Increased knuckle translucency is observed in 13th weeks of fetal ultrasound. Is one of the chromosomal abnormality. Here answer is option D Down syndrome. And the next question, brush field spots, protruded tongue and single palmar creases are the characteristics features of? Options: option A Down syndrome, option B Klinefelter syndrome, option C Edwards syndrome, option D Patau syndrome. And the correct answer is option A, it is Down syndrome. The main characteristics features of Down syndrome, we can see Down syndrome or Mongolism. The first one, they are look like a Mongolian race. Second one, flat face with upward slanting eyes. The next one, flat nasal bridge and oblique eyelids. And the next one, we can see small teeth and protruding tongue. Another one important feature, sloping forehead and low set ears. Another one features semen creases or single palmar creases. And also abnormal shortness in fingers and toes. Large gap between first and second toes. And also we can see mild to moderate mental retardation. These are all some clinical features we can see in case of Down syndrome. So today we discuss some of the previous year questions from pediatric nursing. The next set of questions we can see in the next video.